starting in about 2 minutes, and you can maybe share in the chat where you're from. Tony, hi, good afternoon, nice to see you. Where are you from, Tony? And there's Salina from Enviro Group in Malaysia. We might have even met before. I'm not 100% sure, but I used to live in Malaysia a long time. Don D from the Philippines, excellent. And Richard is from Maryland in the US. Good morning to you, Richard, early bird. We have Tan from Daikin, Malaysia, great. Malaysia in full force. We have Michelle there from GA. We have, Tony is in Russia at the moment. Yes, wow. With Atmo. So we are truly global tonight.
Yeah, we are, yeah.
US, Russia,
Sydney.
Malaysia, Derek from the US. Albert is smiling at us from France.
France this time, but
yes, yeah. From Holland originally. Yeah. Zuraimi from Singapore. Michael, New York at the moment, right? Wow, it's amazing how these webinars bring us together from all over the world. We couldn't have done it without modern technology. And if we would have had to all come together in physical presence, it would have taken us a lot of time, a lot of money, and a high carbon footprint.
Yes.
Get us all together in one place. So great to see everyone here. We have as well Charlotte from Sydney, Australia.
Yeah.
Wow. So it's kind of close to midnight there, right? Or midnight already. That's commitment. Excellent, Charlotte. Great to see you here. So I'll welcome you all formally now to our uHoo webinar. It's great to have you all here. My name is Matthias Gelber, and I have the pleasure of hosting the webinar here tonight. We are looking at keeping your indoor air safe, airborne transmission and mitigation solutions. That is our focus tonight. Now, we have different situations in different parts of the world. We have Europe, North America, fairly high rates of vaccinations. People are kind of getting ready, and maybe they feel safe already, but still infection rates are high. We have here in Southeast Asia, slower uptake of vaccination, but step by step, we're getting there. And we know by now the main threat is an airborne threat. In the early days of COVID, everything was focused on surfaces, surface disinfection, but now we know really some of the key examples of high numbers of infections seem to all point to the airborne transmission. But I'm not the expert. We have great experts here tonight, Zuraimi, Michael, and Albert as well. So I will just give a very, very brief introduction. And thanks to uHoo for bringing us all together. Yahoo and uHoo can closely work together, at least when we look at it historically, right? I don't know whether any of you guys did this, slight spelling mistake before, but it's so close that it has a historical connection maybe. There we go. I would like to start off with our intro poll this evening. Let me launch it. It's always good to get a good idea of what are the issues that are currently keeping us challenged, workplace issues. What are your challenges in managing the risk of virus transmission in your workplace? You can basically, if I'm not mistaken, have a multiple choice here, and you can click on various answers. One is identifying sources of air quality issues, placing and maintaining physical distance, improving sanitation and cleaning practices, employee awareness and compliance with the guidelines, managing and monitoring the employees who begin to show symptoms and don't know where to start. It's kind of this situation you feel overwhelmed. So let us get that initial input from all of you to get the pulse of the audience. where are we? How do we feel about the main challenges that we are currently facing? Let's see what is the number one result that all of you identified here. We have already more than 50% answered. I will close the poll shortly. We have 2 points really running ahead of all the other points. Let me close it now, as we have close to 60% of participants answered. And the number one, I will share it with you, is identifying sources of air quality issues. So we have maybe detected there is a problem. What are the sources of the problem? What is the underlying reason, and how can we address it? And then number two, with the second highest mentions in terms of clicks, employee awareness and compliance with the guidelines. That's a critical thing as well. How can we get the employees on board and really get them into compliance mode? Because to do that discipline day by day is sometimes really challenging. And then the third highest answer says managing and monitoring employees who begin to show symptoms. That's as well, you know, a very worrying period when you don't know whether those who are showing symptoms are actually infected or not. How do you manage them? Those people that have been in contact with them. So these are the key issues currently that we are facing challenges with. So I'll stop sharing the results and hand over to our first speaker, which is Dr. Zuraimi Sultan. He is the program director of the SIN Bear Best program under the Berkeley Education Alliance Research in Singapore. And he is an expert with a lot of experience in this field. So Dr. Zuraimi, we are looking forward to your presentation.
Thank you. Just give me a second. Can everyone see my screen?
Yes, perfect.
Okay, great. Okay. First of all, thanks for the introduction and listening in. Before I proceed further, I would like to acknowledge some of my colleagues here who are also involved in this work. So now we have broad consensus that the airborne transmission of COVID-19 virus through the air is possible, especially in low ventilated settings. And this is important mainly because while we wait for the herd immunity to be acquired in the community, we can craft a set of intervention of procedures that will allow us, or rather allow the economy to come back while controlling the virus. And this is a big challenge. And in the context of today's talk, we should be making the building resilient for the people to be safely working in until we reach widespread immunity. So back in April 2020, when the virus first starts to kick off here in Singapore, we decided to develop this document here for Singapore based on a precautionary approach. It is a non-mandatory, and it was based mainly from our experience as a many years of science and in the field of indoor air quality, mechanical engineering, exposure science, and also based on past research studies on other infectious disease like measles, influenza, and tuberculosis. And this application, this recommendation that we presented here are mainly for the office building, childcare centers, and residences. About 1.5 months later, based on this document, the Singapore government, what do you call this, came up with a technical note that is based on the same principles for building operation under the COVID pandemic. And just in the past month, they further refined the document further. So 3 documents that have been presented over the past 1.5 years so far here in Singapore on how to operate buildings to make sure that we reduce the risk of airborne transmission in the buildings. So what's inside the document? First, we recommend to increase the ventilation within the buildings. Solution to pollution is dilution. That's the basis here. In buildings with air conditioning and mechanical ventilation system, we recommend that the outdoor air supply are set to the maximum setting to enhance the dilution of pollutants within the indoor environment. We recommend operation times to be extended 2 hours before the first occupant walk into the building, and switch off 2 hours after the last occupants have left. If the buildings have demand control ventilation or any such features that only turn the supply air when the occupant comes in, we recommend that feature to be turned off. Secondly, we recommend the minimization of recirculation. If we have a source of virus within the indoor environment and the air contain the virus, we don't want it to be recirculated back into the space and be resupplied into the indoor environment back again. So for air conditioning buildings that have the capacity to operate at 100% outdoor air, we recommend that we can recommend that the building operate in such conditions, 100% outdoor air. If the return air damper should be closed, and then the outdoor air damper should be open fully. The operator should verify that the acceptable conditions can be maintained in the indoor environment, because when you bring in more outdoor air, especially here from Singapore, where the climate is high humidity, you may have some thermal comfort issues if you bring in a lot of outdoor air. So if full closing of the recirculation air is not possible because of the thermal comfort issue that I brought up earlier, you can reduce the recirculation air to a certain amount, and then the air should then be treated using high efficiency filters, which I will talk about shortly. Next recommendation is related to the recirculation as before. This has to do with rotary heat exchangers or heat wheels. Now, the original intent of the rotary heat exchangers is to recover heat or moisture from the different air streams for energy savings. But under the COVID situation, we do not want to recover more than heat or moisture. So to prevent exhaust recirculated air that may contain virus from getting re-entrained through bypass into the supply air, we recommend that the rotary exchanges be switched off, and that we also recommend that any possible leaks within the system, in the wheel system, they are identified and then they are subsequently sealed. For naturally ventilated buildings with operable windows, we recommend to fully open the windows to allow air to flow into the indoor environment. Of course, when you do this, you should be mindful of the of the outdoor conditions and outdoor noise. Ensure that there are no obstacles in the path of the airstream within the space. And then we recommend to increase air motions through the aid of using ceiling fans or desk fans. And then if you have air conditioning in the building that's designed to be naturally ventilated, such as the residential buildings here in Singapore, we recommend that sufficient outdoor air be provided by cracking open the windows to allow some outdoor air to come in. Next, we recommend the use of enhanced air cleaning, in this case, high efficiency media filters. They're actually standard test efficiency for filters in terms of they rate the performance of these filters using what we call the MERV rating of the filters. This range from MERV 1 to MERV 16. So it's necessary to know how well these filters perform to remove the COVID-19 virus. The COVID-19 virus has an aerodynamic diameter of about 0.1 micron, given by the red line here. But but they can also exist in other aerosols of bigger sizes. So in our guidance document, we recommend the use of high efficiency media filters, preferably MERV 14, and they should be installed in the air handling unit um, that serves the supply air and the outdoor air. Also important to note is that when it's just not just installing the air filters. You should make sure that the air filters are correctly installed to ensure there's no bypass and that it is well sealed. And then the facility manager should always inspect the what do you call it, the proper function of the filters to ensure that there's no leakage and that filters are not fully loaded. So all this should ensure that the optimized performance of the filters are all in place. So we know that the virus can be inactivated using UV light, particularly at the 262 nanometer wavelength. This has been there has been a lot of history with regards to the use of UV germicidal irradiation. And many studies have been published over the years, so it makes sense to recommend the use of UVGI technology. We in the document we recommend the installation of UVGI, be it a portable UVGI system, upper room UVGI, or the one that is being installed in the index of the air conditioning system, or or within the AHU. So just ensure that when you install the UVGI systems that they are professionally installed, as because direct UV exposure can be harmful to when it's get exposed. Next, we recommend the use of portable air cleaners, mainly because it has a role because of several reasons. One, they can be used in a smaller space, such as a bedroom or a small office, which can then be easily be moved about, treating all the air within that space. Or you can put them in a space where there's an infected person or a susceptible person, because you can effectively clean the air within that immediate space. And thirdly, because in residential buildings, especially here in Singapore, there is no mechanical ventilation system, so the portable air cleaners can be very useful. There are many technologies out there that uses the portable air cleaners. We recommend the use of HEPA-based portable air cleaners. We do not recommend the use of other technologies like ion generators, photocatalytic oxidization, electrostatic precipitators, because there's potential of the generation of other chemical byproducts associated with this product. So you use HEPA-based portable air cleaners. So one of our minor routes that's being published in the literature relates to the transmission of the virus through fecal oral route. In the past studies, a significant portion of the patients experienced diarrhea and vomiting before the onset of respiratory symptoms. The researchers found detectable genetic material in the fecal matter from the cases, and indicating that the virus are shed into into the stools. So what this means is that when you flush the toilet, the virus could be potentially aerosolized into the air and transported elsewhere. So we recommend the exhaust ventilation system within the toilet should always be kept on, and ensure that the toilet is always under pressure to minimize the risk of fecal oral transmission. And another recommendation is to consider the airflow pathway or distribution within the space. We recommend that workstations be rearranged so that employees do not face each other, or if it's not possible, then we should what do you call this, establish partitions. If fans are used, make sure that the fans are not indirect, they're not blowing from one person to another person's face directly.
Can you
So-
please wrap up shortly?
Yeah, sure.
Thanks. Yeah,
Since
okay,
my last
that's
slide.
it.
So in summary, we have this document that we presented here. So it's easily downloadable from this website. And as I mentioned earlier, that this document should not be used in solely. You should be always working in conjunction with other social distancing and hygiene principles. Thank you very much for your attention.
All right, thanks a lot, Zuraimi. I like your statement, the solution to the pollution is dilution. I think that applies here very well. And if I interpret your presentation correctly, really the future is going back to the kampung house, the village house that we used to have in Malaysia and Singapore, where we have the airflow all the time and fresh diluted air. Maybe the future is the past. So I will hand over to Michael Donham. He is the co-founder and COO of Pure 365, which was founded in 2003 and has been very active in this industry for a long, long time. So Michael, we are looking forward to your sharing.
Great, thank you. First of all, I'd like to welcome everybody tuning in from around the world. It's glad to have you and my fellow panelists. Great to be on with you. Can I ask if you see my file?
Yes, perfect.
You do see it. Okay, wonderful. So I'm going to take everyone 30,000 feet up and take a look at a broad overview. Dr. Sultan gave a great operational guideline on how we should handle buildings. I often tell people that everyone born into the world, we have two things. We have something in common. We have essentially two homes, and those who are lucky, out of us who are lucky, we have a third home. And people are a little puzzled when I say this, but let me explain in detail. So the two homes that we have, everyone in the world, first one is our body that houses our cells, right? We see that as a home. The body operates to protect our lives, right? The second home is the home we all share together, the natural world. We're tuning in from all over the world. We have one planet that's also our collective home. The third home that I speak of is the one that we sleep, live in, four walls. We could also be your workplace if you spend a lot of time in your workplace, right? But two are natural and one is man-made. And so Dr. Sultan went over a lot of it, but when we look at the man-made building, if we want to create an environment that protects us against things like COVID-19, that's just one of the things, right? There's so many other things that we're exposed to that can harm us. Then we really got to take cues from the natural homes that we have and how those things operate. And what we want to do is we want to mimic it as close as possible to these natural processes of things that protect nature, protect the natural process. So with that, I'm just going to share this quote by Dr. Joseph Allen. He's one of the leading authorities, especially with COVID, on how to protect people within buildings. And he pretty much says that if we manage buildings poorly, we're going to pay the consequences. But if we get it right, it's going to go a long way in protecting the public health, right? And so let's go into it a little more deeply here. So when we talk about indoor air quality and the 360 degrees of it, we have to look at, and Dr. Sultan went through all of these facets, right? But what do these things mean? How are they interconnected to our health? And let's look at it from a 30,000 K view. But all three of these are essential in protecting our health within the built environment. So let's start off with air purification. There's another word for it, is air filtration. And really what this is especially since the onset of the Industrial Revolution, massive particulate spewing in the air, polluted cities where over half the global population live in, so we're exposed to it. 90% of the human population are exposed to air quality levels that are beyond what the WHO limits are, right? So we're all exposed to this. But if we go down a little deeper, it's the 0.1 micron. Dr. Sultan mentioned it. That's the size of the COVID-19 virus on average. the particulate at this size is small enough to go through the lower respiratory tract, through the lungs, into our bloodstream. And what this does is it inflames every cell and organ in the body. It weakens our systems. So there are studies that say people living in counties with high levels of particulate are 15% or more likely to die if they contract COVID-19. So if you're breathing in a lot of particulate, it weakens your system, exposes us to the dangers of things like COVID-19 on a greater level. So I 100% back Dr. Sultan and the studies. We want to have at least close to HEPA filtration to try to capture as much of these ultrafine particles in the air. And ultrafines make up 90% of the particles we breathe in. But a lot of people don't really focus on that. They focus on PM 2.5, you know. So it's one thing to consider. Filtration, having a HEPA air purifier near you is going to protect your health. So next thing, I want to go to the topic of ventilation. This is really about carbon dioxide. So going back to the human level, our bodies, we breathe in oxygen, we breathe out carbon dioxide. It's to create that balance, right? To oxygenate our cells, keep the blood active, healthy, right? Let it do its job properly to preserve life, enhance life. So what's going on now is over time, like I said, with Industrial Revolution and what we're doing as a human race, like to build stuff, all these things we're doing to harm the planet, what this has resulted in is an increase in CO2 levels all the way from 280 pre-Industrial Revolution. And like last month, there's a station in Hawaii, they monitor all the CO2 levels. It was at 420, highest ever in history. So what happens is we get exposed to all the CO2. If we cut off the ventilation in the space, we're breathing high CO2 levels, we're exposed to it. And the next thing I'll show you here, how does this impact our health? So if we go over, I usually say 800 ppm, it's going to start impacting our cognitive functioning, right?
Michael,
so,
we have only your first slide still on the screen. I'm not
Oh,
sure
no.
whether you think we have moved on, but yeah. Thanks, Dr. Zuraimi, for the note.
Oh my, that is horrible. I've been I'm gonna try it one more time, sorry.
Maybe it changed on your screen, but not here with us.
Do you see the screen now?
Yeah.
Okay, sorry, I'll keep it on this screen. So these are some of the other screens that I showed. So this is the particulate. It shows 0.1 and how it gets into the bloodstream. That's really what does the most damage, the smaller ultrafine particles. And this is the screen where I talked about the carbon dioxide levels through history rising to 420, where we are today. And so when we breathe all of these high, when we're in an environment where the CO2 levels are high, not only are we more exposed to viruses in the air, because high CO2 levels typically means that we're not getting enough ventilation with outside air, right? So we're going to have more exposure to aerosols that contain the virus. But on a physical level, also, if you're like over 1,000 ppm, those carbon dioxide concentrations can really cut our basic decision-making, studies show, by 25%, and complex strategic thinking by 50%. So if you're an employee or this has got to have an impact on your decision-making. First of all, we need to do it for everyone's health. Second of all, we want to create environments where everyone is performing to their highest potential, right? So this is really what the health impact is for poor ventilation, not only exposure to aerosolized viruses, but anything you go over 800 ppm, you're going to have that cognitive impact. And how do you know if you have high CO2 levels? You need monitoring in place, right? So that was part of the poll question. If you don't know where you are, you can't address it. So that's really, really important. The third aspect, aside from filtration, ventilation, is humidity levels. This is kind of under the radar for a lot of people, but if you look at the quote there, the patient physiological barriers and passages from the nose to the depth of the lungs are most functional between 40 to 60%. It's because the mucus line passages prevent pathogens like COVID-19 from getting deeper into the tissues, but when it's too dry, they dry out, they can't protect you as well. So there's an optimal zone here. If you go too low, you're going to be susceptible to viruses, bacteria. If it's too high, you're going to be susceptible to things like mold, asthma, rhinitis, allergies. So you really want to keep your built environment in the 40 to 60 range. More specifically, if you look at this study, it shows that daily new cases, daily new deaths. This is a study from Harvard and MIT. They found that the lowest amount of new cases, lowest amount of new deaths were in built environments where the relative humidity was around 55. So I always keep my humidity at 55 because of all these studies where optimal health and humidity control are related. So just to wrap up here, this is another organization aside from the International Well Building Institute, FitWell. It's a great resource to learn more about how to use science to create the healthiest environments. They also give certifications to give people more peace of mind. And 3 other things that we talked about here: increased ventilation, optimal humidity, filter indoor air are key components of protecting people within the built environment. And then obviously we want to make sure there is a chance that if you touch something, you wipe your mouth, you can get exposed. So we want to wash our hands, and there are cleaning protocols just for basic, basic level cleaning. And the last thing I want to say is the most important thing, and I think if you don't know what the status of your air is, there's no way you can get it to optimal levels. So it's really important to have monitoring in place, and then using that monitoring, the insight that comes from it, and then to optimize the space through your ventilation controls, humidity, filtration controls to keep everything at an optimal level. And that's what's going to get us through COVID, even amidst this Delta variant. But even after COVID, once we're back into the new normal, it's going to happen again. And it's also our overall health. So things like the uHoo Aura top-rated monitoring system, there are others. It's really important to have these types of technological tools in place, and nothing can match our natural monitoring system in nature and our bodies. But in the building, we want to mimic it as close to possible using the latest technology. So I hope I was able to share something new for you, and happy to be with you and move on to the discussion.
Great content, Michael. Thanks so much. I fully agree with you. You know, if we don't monitor what's going on, we don't know what's happening. I remember being in a bank at a meeting in Subic Bay, and I switched on my uHoo. That was before the pandemic, and the CO2 levels there was above 7,000 ppm. And when I told those guys there, they kind of didn't really know, but the lady who was running the bank was quite health conscious, and she asked immediately, what can we do? But one thing, you know, you mentioned 40 to 60 humidity. That's in line with the uHoo virus index as well. How do you actually maintain that in your building? You said you always kind of keep it at 55
Right.
level. What tools do you use?
So most of the solutions that I deploy are in the residential space, and we do commercial as well. But in the home environment, it's much easier, right? Because you have either a whole house humidifier or a whole house dehumidifier. So when you set your smart thermostat or smart control at, I keep it at 45. I mean, I keep it at right around 50. Then if the humidity starts to go down in the wintertime, then your whole house humidifier kicks on and puts more humidity through your HVAC system. Vice versa, in the summer, the dehumidifier kicks on and brings it down to that level. In the commercial space, you have those same tools, but not a lot of buildings implement whole building humidification systems. So it's a little more challenging.
Yeah, actually, I stayed in a beautiful hotel in Langkawi, and they had humidification And with good humidification, you virtually don't need any cooling anymore. It can actually save money. That was the thing that struck me. You know, if we find the right balance there, and in Southeast Asia, too high humidification, your building quality goes down very fast, and you get mold issues. So yeah, that's an interesting topic. But I'd like to pass over now to Dr. Albert Grunewald, our good friend from the Netherlands, who is really looking after the uHoo medical marketing side of things. And he is a very seasoned contributor to many of the different uHoo webinars. And he will give us his comments on the two presentations and the topic in a short 3-4 minute summary. And then we will go over to your questions and the open debate. Albert, over to you.
First of all, I'm very pleased with this webinar and also with the presentations by Zuraimi and Michael. I think I've attended many webinars, but you have been able to comprise the complexity of the importance of indoor air quality and what does it mean for the people and for the buildings in a very comprised way, I must admit. I've also the feeling, to be honest, let me start, that in Asia, people are more willing to listen to these kind of measurements or regulations compared to Europe. We are really running a little bit behind. And but as you are also mentioning about COVID, it will not disappear. We will be talking about COVID-19. We're talking about variances. We have now the Delta variants, Epsilon, etc. will follow. So I think we should be taking care of our indoor air quality and to reduce the spread of the viruses. Before mentioning something about what is uHoo doing to reduce the spread of the virus, I would like to ask a few questions to the speakers. First of all, Zuraimi, you're talking about the issues of recirculation, filter checks, UV radiation. These are all measurements which are effective. But my question is, how are we checking it? How do we know that we're doing the right way with all these measurements?
That's a very good question. I mean, in office environment, we can check the dampers opening at which set point so that we can actually know the exact amount of fresh air coming in or the circulated amounts that is coming in. It can be very difficult for the residential buildings because the level of control may not be as refined as in the office building. So yeah, so that's the downside with regards to the office environment for the residential side of buildings. And one way of determining the whether you have adequate ventilation in the space or not is obviously try to measure the CO2 using a simple CO2 monitor. If it has a CO2 level of which is below 1,000 parts per million, that indicates that you don't have a ventilation issue problem within that indoor space of yours.
Yeah. And apparently you have a lot of experience also with UV radiation to fight against the viruses. How long do you need to install these devices in your room? How many hours, how many days?
Right. So there are different ways of operating the UVGI systems. I mean, for example, the upper room UVGI, these are mainly installed within the indoor environment itself. There is a guideline that's provided by the NIOSH CDC to safely install in the indoor environments and also specify the number of units to be installed within one particular floor area. So those standards are already there that can be used for us to design the number of UVGI, and they can operate as long as the lamp lasts. So yeah, you can turn it on until such time where you think there's no need for it to be turned on.
Yeah. Okay, thank you, Michael. I was also very pleased with your presentation, and you know, I like science as well. I think everything our decisions should be based on science, and as I'm a physician and acting as the chief medical officer at uHoo, we thought about how can we deal with this COVID pandemic, and so we came up with a so-called virus index, which is built in our app and on our dashboard. And basically that is based on 5 indoor air quality factors. And you mentioned one of them is the relative humidity. So we are saying it should be between 40 and 60. Also temperature is playing a very important role. And what we are saying is that the temperature should be between 19 and 24 degrees Celsius, which is in Europe and perhaps in North America easier to achieve than in other countries, but it is achievable. And also we are looking at the particular matters, because particular matters, what you also mentioned, is seen as a carrier for viruses because of the small diameter. And so we are measuring also the PM 2.5 and 1, and we are saying the levels should be less than 50 microgram per cube meter. So that is a level. And also we were mentioning the CO2 should be 800 or less. That is optimal, but 800 and 1000 is acceptable. And what we're also doing is looking at the NO2 levels, because these are also affecting the immune system of people. And it should be below 53 ppb. And all these, so we have now created that index, this alert. It is at the moment pending, and I published, because I'm a physician, I published a white paper, and there it was mentioned how we came to this index. Normally you receive a lot of criticism all around the world, especially when you're talking about the airborne diseases, but this time it wasn't. So basically the acceptance is there, and what we are doing as a company, we try to inform the people to get them their awareness about that the virus can be spread in the room, and at the same time we're doing also kind of tests. We are working now in care homes in the Netherlands, where we try to maintain all these levels, and they've had a pandemic in the past, and if they reach these levels, there is no virus spread. So it's helping. We're also working with schools, offices. So we're trying to also to bring all the things in practice with the monitoring of uHoo, and that's what we're working for. And but we need people like you, need people like Zuraimi working in the buildings, trying to improve it, and together we can cope with this COVID pandemic.
Actually, Albert, on that note, we had one question that was asked in advance that fits very well into what you just shared. It's basically, what is the best strategy to reduce a high virus index in a naturally ventilated residential apartment? That's interesting. I would assume the high humidity could be a reason why the rating is quite high.
Yeah, and also temperature. These two things, I think temperature and relative humidity are quite easy to control in a house. And also doing the ventilation. I mean, the CO2 levels, open windows. Also, even during the night, or even when you are living close to a road with a lot of traffic, keep the ventilation going. That helps. And we have also seen that in a test with 100 homes where people are, and also we have an app and people can see what's happening. They get an alert, and also we give them advice what to do. It's all about the behavior. A lot of things has to do with behavior next to the technique. It is the behavior of the people who can change also the indoor air quality in a good way.
All right, thanks a lot, Albert. We have questions coming in. One of them, for example, was, I think you've answered it already, Zuraimi, in writing, but I saw another question which seems to have disappeared again, but I still remember it. Can you explain more about the air dilution part? I think, you know, it's very interesting what we have done in the past, right? We recirculate the air and we recover the heat. But I remember a case study from a German meat factory. The main reason that the scientists who analyzed the high infections, that was more than half a year ago, was the recirculation of the air through the different departments that had spread the virus very, very fast. So that's why we need to avoid it, right? But we need to dilute the air by bringing in the fresh air from outside. Can you explain a little bit more in detail that aspect? That was one of the questions.
So, so as I mentioned earlier, if you have an indoor source of pollution within the building, and this is always generating, let's say in this particular case, the COVID-19 virus, you don't want it to be, you don't want the air to be recirculated into another part of the building within using the HVAC systems. So one of the ways to avoid recirculation is to increase the amount of outdoor air coming in. So as you bring in more outdoor air into the space, you're diluting the concentration levels of the COVID-19 virus that's being released by the patient.
Great, great. So to all the participants, feel free to add additional questions to the Q&A part. That's the easiest. Then we can either ask them, answer them verbally, or we can answer them in writing. You can see some questions have been answered in writing already. We had a couple of questions in advance here. I will go into one or two of them. Actually, several were linked to the Delta variant. What are the preventative measures against the COVID-19 Delta variant? And is Delta variant airborne? I think we have partially answered that. Maybe Michael, you can start off, and then Dr. Zuraimi can comment on that as well. There was another one, you know, asking how can we slow down the Delta variant? What do we need to do?
Well, it's CDC just said some vaccinated should even wear masks now where there's a high exposure risk, right? So it's certainly a concern. And I'm looking at the studies and looking at what the scientists are saying, but it's the similar strategies that we spoke about today, right? When you're going into an environment with more people, you're not sure who they are. You want to be sure you have all of these strategies in play that Dr. Sultan outlined. But personally, you want to make sure you have a mask. You want to make sure, you know, I've seen studies where one of the top virologists in America, he was on a plane, had a mask the whole time, but he caught COVID, and he suspects through his eyes he got it. Yeah. So if you have glasses, that's actually a protective barrier. And if you don't wear glasses, just to have no dosage, no prescription glasses, sunglasses, it's actually a protective measure. So little things like that, they may not seem like much, but it could be the difference, right? And so just being careful where you are, and your home too. I don't know how many of you invite guests, and I haven't invited anybody the whole time, but you know, some of you may invite guests, you just don't know who has it. A person who's vaccinated can, it's called a breakthrough, right? They can get it again, contract it again, and they can contaminate somebody. So it's a very concerning time. We just all have to be vigilant and keep to the sound practices that have been taught throughout this time.
Yeah, I fully agree with. Yeah, I fully agree with that. You know, washing your hands, keeping distance, wearing a mask, and also in a crowded area, and keeping the distance. It's a way of doing it. And also, if you have, and sometimes difficult, if you have symptoms that could be comparable to another virus infection or cold. The problem with the Delta variant is that it is not more effective than the other one, but the people get more sick of that. If you are contaminated and you get sick, then it is getting worse. That is the problem. But I also believe that through vaccination, people get more resistant to these kind of virus infections in the future. It will take a while. You will get at the end also a group immunity that will appear, but we don't know when. And but until then, we need to. I think one of the things you need to do is avoid very crowded situations. People gathering together in a dancing discotheque or whatever. I think that should be one of the things you should avoid.
Yeah, I have the next question, and I'll pass that on to Dr. Zuraimi. It's from Roger, I think. I have this Richard Katan. It seems like UVGI, and for everybody's information, UVGI stands for ultraviolet germicidal irradiation. That's quite a mouthful, but basically killing the viruses with UV. Here in the States was like the Wild West. What criteria outside of 254 nanometer do you use to determine effectiveness of a device? I suggest maybe I'll pass that on to Dr. Zuraimi.
So I'm trying to get the link to the standard from NIOSH. That's what it seems to be. My computer seems to be hanging right now. So yeah, I have the link here. So I'll be sharing this link very quickly over the chat. So this link here provides the standard of how to operate the UVGI, upper room UVGI in the space. So this is well published using UVC light to the main purpose is to address the infection that's related to tuberculosis. So it is very vigilant. It's very virulent, and there's a lot of research that's being done on this topic here. I don't know whether I addressed your question. I see that you said thank you.
Yeah, I think we have as well quite a lively and controversial debate that was kicked off by Michelle on the bipolar ionization product. I think Michael, Michael wants to share his views as well. I shared mine already in the written comment. You can see that if you go into answered sections. So Michael, over to you. What's your view on it?
Well, Dr. Sultan mentioned it, like ionizers or air purification products that use certain technologies. And for those who don't know, NPBI is needle point bipolar ionization. And certainly whenever you look at an air filtration product, you want to look at the certifications, you want to look at all the airflow, the ratings, right? The efficiencies. And what you want to look for is true total efficiency. It's not the number, like it's like when you buy a car, it says mileage, but then when you drive it and the mileage is way off, then you know you're going to be upset, right? And so that's why certifications are so important. So Michelle, when you mentioned the UL certification for no ozone, awesome certification. UL is something that you can trust for the most part. And so it may not give off ozone, but there are a lot of technologies that play with the chemistry in the air that will create free hydroxyls, you know, things that can harm us when we breathe it in. So we have to be very cognizant of that. The other thing is there are a lot of studies, like the scientists, when they talk about ionizers, there's a lot of studies going on. If you just Google it, a lot of universities, University of Boulder, they talk about real life. So a lot of their testing, they say this gets rid of all the pollutants, everything. But when you do it in a real life setting, it isn't the same. So you really have to discern, is it really effective in a real life setting? And you did write that particulates are low. From my testing on ionization systems, they don't reduce particulate very efficiently. So you have to look at it as if your system is actually reducing it, or if your portable air purifiers are doing it. So there's a lot of things to think through, but there's a lot of things in the in the public domain that you can read up. I'm happy to share those resources with you if you contact me. Yep.
I see Zuraimi is typing another answer, so look out for that. There is a very lively debate here on that subject. We have the next question from Don Lagman. Do we have a technology that can detect COVID virus in the air? Very interesting question. Has anyone invented such a blockbuster technology? Albert.
Perhaps I can try to give an answer. There is until now not a good technique, but there are some tests ongoing. In the medical field, you have so-called e-noses. These are devices which could detect also cancer, or the beginning of cancer. And at the moment, there are tests being doing in the Netherlands where you can perhaps detect if there is also a COVID virus in the air. These are tests which are ongoing. The Institute of Leiden said it's promising, but I have not seen the results. Another technology is, of course, looking at the filters, because we know that filters, HEPA filters, can take out the virus from the air. So if you have a filter, if you look at the filters, then you can see which kind of viruses are on that filters, then you know which ones are in the air. That was perhaps my thinking. Don, is that, Michael, is that okay? Do you think that could be something?
I've seen companies trying to come up with something like that. I haven't seen anything that's widely accepted as being
exactly.
efficacy. So we'll see. I mean,
yeah.
It'll be interesting to see what comes out to market.
Yeah.
Yeah, and there's a comment from Elijah saying he used gelatin membrane filters using active air sampling and testing with qPCR. I should have paid better attention in chemistry in those days. We found positive samples at hospital settings. So maybe you can clarify, Elijah, exactly, was that related to overall COVID detection or anything in specific? And we had a question as well that's a very practical question that came in advance. I think I want to share that with you. One uHoo user was asking, what do I do if I suspect that combustion appliances are affecting my health? I guess as well that user will have detected higher levels of PM 2.5 and so what should that person do?
You definitely should get an air quality monitor, and any backdraft of combustion equipment like your water heater or your heating system, you're going to detect levels of carbon monoxide. That's going to be very hazardous. Like hundreds of people die because of things like that, right? Leaving the car on, backdrafting. So monitoring and alerting. But the best thing is to swap it out to an electric based. That's what there's a huge movement in the US for healthy buildings. Get rid of combustible equipment in your living spaces.
Yeah.
And there's actually an additional comment here. What is the average level of carbon monoxide in homes? I mean, I would have said, hey, it should be 0, but is there an acceptable level of carbon monoxide, Albert?
It should be 0. Before you die, you should have extremely high values. But it is known that even with low values, people get symptoms like headache. They don't feel well. And that's what we have seen also in some of our tests, that very low levels, which are not that high that you get immediately that you're dying, but continuous low levels can also, then you have symptoms like headache and something like that. So, but what are these levels? We are talking about levels of less than 5 or about something like that.
Yeah.
So
All right, great.
So I'd like to add on that that's about the CO. In Singapore, there is a guideline on the indoor air quality that stipulates that the CO level should not exceed more than 9 parts per million. Yeah, but that's a little bit on the high side. Yeah.
High side, yes.
Yeah.
All right, great. I think we had excellent discussions. We will see a short video, then we'll do an exit poll, and then we are finished. And Lilette will follow up with you guys on the video and the presentation slides. And thanks for this lively discussion and many interesting questions. Maybe, Cheska, you can start the video. Yes, great. Get yourself a uHoo to know what's going on. And before we send you all back to sleep, at least here in Southeast Asia, let's have a quick exit poll. Whom would you want to follow up with? There's Dr. Zuraimi, Michael Don, Albert Groenewold, or myself. Just click the name, and then we will let everybody know whom you want to follow up with. And I think all the speakers did great today. The comments from Albert, I really enjoyed it. I learned a lot. It's great as well to see that we had a lively discussion. Thanks to uHoo. I would just have one request for uHoo. Next time you make another version of the video, why don't you try and make one of the guys, especially the one who present there, look like Dustin? That would give us an additional entertainment factor in the video.
I will ask Dustin.
Yes.
I will do it. Yes.
That was just what came up to me, you know, the guy that was giving the presentation. I mean, had a bit of robotic moves, that guy, but
yeah,
would be nice if he would have looked like Dustin. All right, great. Jokes aside, yeah.
And he will be a great influencer. Okay.
Good. Yes, will be extra entertainment with the video. Great, okay. Excellent. We have
Matthias, thank you very much. It was great.
Thank you.
Thank you, Michael. Yeah. Okay,
great.
Thank you. And hope to see you soon in physically somewhere.
Yes.
Likewise.
So we have a couple of people that want to follow up with Michael and with Dr. Zuraimi. Nobody wants to follow up with you or me, Albert, but that's okay. We were not the main guys tonight. Thanks to everybody, and see you again next month with our next webinar, where we are again focusing on certifications and how they can contribute to the green building enhancement and optimization. Thank you, everyone. See you soon again. Good night, good morning. Have a super day. Bye-bye.
Bye-bye.
Bye.